The global burden of oral diseases actually depends on where you are, as well as who you are. So we know that the burden of oral diseases are borne by people who are most vulnerable, those who are living in poverty, those who may not have access to a dentist, or those who may not know that they're supposed to visit a dentist. With children, we see different aspects with how oral health can impact overall health, and especially with mental health, with children being less self-confident, lower self-esteem, and some form of social isolation. That's what we call the power of a smile. If they have oral disease, if they have caries, decay, and so on, they don't want to smile. They don't feel good about themselves.
There is no better illustration of our purpose than our flagship public health initiative, Colgate Bright Smiles, Bright Futures. Together with parents, teachers, governments, and NGOs, as well as dental professionals, healthcare providers, and our customers, Colgate is able to educate and inform children and their families about the importance of oral health every year in more than 100 countries.
So today we are actually bringing our mobile van unit to a school, and we'll be providing free dental screenings to children in this neighborhood and also in this school for 12 and under. We get to get in front of a lot of oral health disparities and a lot of oral health ailments that children might be having. Because when children are in school and they're suffering from a toothache, it's very hard for them to concentrate. It's very hard for them to consume nutritious meals. And they're missing school as a result of that. It is literally the best thing to see kids' faces light up when they get to see the van, and when they get on the van, they're like, oh my, it's a dental office on wheels. They're never really afraid because it's such a rewarding and fun experience that they're like, oh, look what I did. And then when they get off the van and they have their little oral care kit, or their goodie bag as we call it, they're showing their friends, they're showing their parents, they're showing their teachers. So they always take something away. And when kids take something away, they love to brag to their parents or brag to the guardians in the house as to what they learned today when they came on the van. Some of the things that we are able to do on the van when we visit the children is, besides going through proper hygiene, we also go through nutrition. We also talk about the importance of exercise with them as well. We fill out a report card for the kids after they come on our van. And the report card lets the parents know your child needs to see a dentist for XYZ reasons. And within that same report card, we also give the kids, and even parents are also able to get the toothbrushes that we also offer with the educational information that's inside of it. So that way they can continue to have education as it relates to oral health. I love the opportunity to work with kids one-on-one and get them to see how important it is to do brushing, to go over jumping jacks. Like, it's just a fun, rewarding experience. But nothing speaks more to me than when a kid comes up to me and says, thank you. This is the first time I've gotten my own toothbrush.
Poor oral health among expectant mothers can cause very many conditions, but among the commonest is premature delivery. This one results due to secondary infection. Mothers in pregnancy with the pregnancy complications have died because referral system was not well managed in the past. Nurses are the best vehicle in promoting good oral health among mothers because they are involved at all levels where mothers and their babies are taken care of.
My perspective has really changed because I have also realized that we have really ignored the issues of oral health and we have not given the importance that needs to be given, especially in our day-to-day activities. It is very important to do assessment for mothers who come for the clinic for dental health so that we are able to diagnose these conditions as early as possible because it impacts so much on their health. And also I've realized that it is very important to be an advocate for these patients because there are those who are not able to get the information, they are not able to get the services, and they are not able to access a hospital.
Colgate-Palmolive as a company has been very supportive in educating healthcare workers in Kenya. They've made sure very many mothers who come for antenatal care and even after delivery, they get adequate education on oral health. So this one has created a paradigm shift in the way and in the perception the healthcare workers had been handling oral health.
BSBF, or the Bright Smile, Bright Future, is traditionally implemented in primary schools, covering students ages 6 to 7 years old. Now, the focus is the whole community. The approach on how oral health should be covered changed because a lot of children have already dental caries even before they reach school age. So today, we have this barangay oral health activity. We have toothbrushing activity. We have lectures for the parents. We involve the barangay officials so that we engage everybody from the community. Although we have started out doing prevention activities through fluoride gel and water fluoridation, we significantly adopted the usage of fluoride varnish. And in effect, we have increased and efficiently reached more children through this program. More children are ready for the next level in school. They are more knowledgeable in how to take care of their oral health. We have to admit the fact that there can be no total health without oral health. I hope to see a sustainable policy with a framework of action for oral health, a policy which is not only programmatic but rather holistic and integrative, a future full of smiles.
With Bright Smiles, Bright Futures, we know that we can make a positive difference in the lives of children when we show them that we care about them and their futures. It's all about the whole child, whole school, and the whole community. Thanks to teachers, dental professionals, nurses, and other organizations that work with us, we have been able to reach 1.6 billion children over 30 years and in 100 countries. Showing how we care gives children the power to smile and feel good about themselves.
Colgate-Palmolive people share one purpose: to reimagine a healthier future for all. And with our Colgate brand found in more homes than any other, we embrace our responsibility to build a better world. When a Bright Smiles, Bright Future van goes to a school or a nearby store, a child can meet with a dentist and receive toothpaste and a toothbrush. Sometimes that's the child's first visit with the dentist, or maybe even the first toothbrush that child has been able to call their own. They take it home with great pride and a smile. And we smile too, because we know we are setting a foundation for a healthier future and a brighter future. Every day, everywhere, for everyone.